Okay, it's just getting ready to be on the live stream, and there we are. Okay, thank you everyone for joining us. My name is Paveen. I work at the University of Sheffield and Doncaster and Bassetlaw Teaching Hospitals, and this webinar is we organize it from the platform of Shiver. Shiver, Sheffield Institute of Interpersonal Violence Research Network, is a network which is co-led by myself, Michaela Rogers from Social Sciences, and Julie McGarry from Allied Health Professionals. You are going to learn more about Julie and her talk in a short while. And through this network, what we aim to do is talk about issues related to domestic abuse, gender-based violence, and issues around that. Today's webinar is one such webinar in which Professor Julie McGarry is going to share her knowledge and information from one of the projects that she has conducted. So Professor McGarry is Professor of Nursing and Gender-Based Violence at the University of Sheffield, in School of Allied Health Professions, Nursing and Midwifery, as well as Sheffield Teaching Hospitals. And as I say, she's going to tell you a little bit more about herself, and then we'll take up on with the presentation. I would suggest that, if you could just keep writing your questions into the chat box, we'll be able to, once Julie has finished her talk, we will have time for discussion and questions, and we can take it at that time if that's okay. So without further ado, Julie, over to you. Thank you.
Brilliant. Thank you, Parveen, and thank you everybody who's taken the time to join today. So I'm going to stop my video, and then I'm going to share the slides. And it is a little bit of a double act because we have a video to show you, which Parveen will put up at the appropriate time. Okay, so any issues with the slides as they go up, please shout out. So I'm going to share the slides now. And you should all hopefully be able to see disrupted narrative. If anybody can't see that slide, please tell me now. Okay, right. I'm going to.
Can't see that. Just got a slide with your name on.
Oh,
can't see it.
Hold on.
No.
Right, hold on.
Yeah, I'm the same.
Hold on a minute. We'll start with them. Right, hang on a minute. Yes, it's it's just seamless, isn't it? Right, okay.
Yep, I can see a slide now.
Yeah, go back.
Perfect. Okay, can you see the first slide, disrupted narrative?
Yes, all good.
Oh,
Go
good.
on.
Right.
Perfect.
Okay. Has it moved down to about me?
Yes.
Perfect. Right. Okay. Lovely. Right. So to start then, so just to tell you a little bit about myself before we start. So I'm a registered nurse in adult mental health fields of practice. And as Parveen has mentioned, I am a professor of nursing and gender-based violence at the University of Sheffield and Sheffield Teaching Hospitals. And I've been in post here since November 2021. Prior to that, some of you, I've not looked at the whole sort of chat list, but I suspect I probably know some people from Nottingham and elsewhere. But prior to joining Sheffield, I was at the University of Nottingham, but also just prior to appointment, I was the trust-wide lead for sexual safety and domestic abuse at Notts Healthcare NHS Foundation Trust. Again, it was a joint appointment. And it was based around my background, really, clinical background in safeguarding adults and children. My academic background is in health sciences. I did start off as an epidemiology, working in at the University of Leicester, but found my home really in qualitative methodologies. So an ethnographer, and more latterly arts-based co-production. And I'm going to talk a little bit about why I kind of moved to that area, why it's important, and what we've been up to. I'm really mindful about the topic, and I know people have come to the topic. Many of you will have a background expertise, be working in that sort of space, but I do want to start before I start by saying, it is a sensitive topic, and it's just exercising a little bit of caution about what we disclose and discuss in this space. But obviously we are about afterwards, if there's anything that it brings up for people who need to be directed or to have a discussion afterwards. Okay. So, right. Okay, so defining the subject. So I'm not going to read this out. I'm sure many people will have seen the UNICEF definition. There are many definitions. I've chosen this one particularly today because I am talking about gender-based violence. And that's not to say that violence does not and harm does not affect everyone, but it is to acknowledge that it is gendered. And some of this is around the power imbalances and such like, and we don't have to look too far really to kind of think about examples of that within our sort of contemporary world. Okay, so that's just by way of a little bit of background. Okay, why it's important. Again, I'm speaking to people who already kind of know why it's important. We know something about the extent. We know it's devastating, and we know it's not defined by any particular characteristics. What we do know is that it's ever evolving, and so, and particularly, I think pandemic eras has sort of taught us, I think, in lots of ways, that we can't try and kind of corral it in any one particular way. So, what I wanted to talk to you about, or talk with you about today, is about disruptive narrative and the case of sexual safety, and why, I guess, we work towards where we are today. So sexual safety is widely recognised as a significant global issue, sexual harm, sexual safety. Sexual safety is not really a term I think that we used or was in common sort of usage, but it became more prevalent after a report in the UK in mental health contexts around some of the issues around sexual safety and sexual harm. And that really was the impetus for my post at Notts Healthcare. It's a priority for healthcare systems promoting safety. And as with gender-based violence, we know sexual assault has a wide definition, includes physical assault as well as coercion, and occurs in any setting. So again, we're just sort of setting the scene a little bit in terms of sexual harm and sexual safety. So we know that the impact of sexual violence is both immediate and longer term. In the UK, women are more than 5 times more likely to experience violence than men. And those who experience mental ill health experience a particular risk. We also know that those working in mental health contexts are poorly equipped to recognise or respond to sexual violence. Some of the issues around power imbalance and credibility, and we've had a high number of profile cases. So for those in the UK, the Savile inquiry, for example, which led a lot of commentators to ask the question, how did this happen in plain sight? And actually the impetus around sexual safety, sexual harm was the catalyst for my role at the Trust. So to talk a little bit about the original study, I came into post following a serious case review. And what I was asked to investigate as part of my role was not the incident itself, not the serious incident itself, but what had happened after the serious incident, because to all intents and purposes, and the incident itself, it's widely documented, it's in the public domain, so there isn't a kind of confidence or confidentiality issue. There had been a sexual harm occurred to a female patient by a male member of staff in an inpatient area. Measures the incident being investigated and such like. I was asked to look at 12 months post incident for more of a a deeper investigation as to not the mechanisms that had been put in place, because we all know, any of us who work in a health context know that we have an incident, there are recommendations, we put those recommendations in place. But what I guess is less transparent is what is the impact of that incident, and how do people feel in that environment, and what impact have those changes made. So that was really what I wanted to explore with staff. So the study itself was qualitative, and I interviewed 8 members of staff who had been working in the clinical area at the time of the incident and who had remained in that space. So some members of staff had moved out, but 8 were remaining. All but 1 participant were male, and the full study has been reported and published. And there were 4 themes identified, but for the purposes of this presentation, I just want to look at 1 theme only, because that was really the catalyst for the work around disrupted narrative. So this theme was the discredited narrative. I'm not going to read it out for you. I've highlighted some of the kind of tensions in the text, but I'm just going to give you a moment to read through these, to just have a thought of what this might be saying. Okay, I'm going to move on. Okay, so the lady in question had a diagnosis of personality disorder, history of allegations of sexual nature. Diagnosis of the victim, again, her history, presentation, a lot of manipulative behaviour. She did appear to have a good bond with him, and that was noted. So I suppose what that really said to me was that there are some issues around the discourse that we perhaps use surrounding mental health, domestic and sexual violence. It's assumed the language really of professions, and the disconnection, I guess, between the language that we speak and the kind of way, the voices of experience. So, for example, if you have a trauma narrative, it doesn't always make absolute sense to an outsider. It isn't nicely packaged together. It can seem incredible and therefore discredited. The language of professions, for example, where diagnosis has been seen as the prevailing way of kind of identifying with an individual, can be unhelpful. So for those trying to tell of their experiences and be heard, the positioning of the fractured narrative, which is not objective nor dispassionate within the dominant discourse, has often been aligned to the incredible, and therefore, as I mentioned, the discredible or the discredited. So based on the findings of that work, we really wanted to think about how do we hear those voices then? How do we get those voices into a more public, a more dominant space than they've held? And really, we'd been working with arts for quite some time, and we started to develop our thoughts and our thinking around a project that would bring those narratives to the fore. How could matters be made meaningful, basically? So again, arts-based co-production, myself with Parveen, our colleague, Catherine Hinchliffe from De Montfort University, as I mentioned, have been working with arts in different ways. And so we decided, working with our colleagues, who I'll talk a little bit more about in a minute, wanted to look at arts-based co-production in the very context of disrupted narrative. to try and disrupt what the dominant discourse to date has been. So the project team then for this particular piece of work were Juno Women's Aid, the women and staff, Molly Brown from See Speak Here, Animation, Film and Design, Dawn Bowden, who we'd worked with previously, who's a freelance arts practitioner, as I mentioned, ourselves, and a big thank you to the Arts Council England, who funded this piece of work. We had tried elsewhere to secure funding and had been unsuccessful. The Arts Council were extremely positive and were very, very happy to provide the funding for this piece of work, of which we are very grateful. So working with women through Juno's Women's Aid, we worked in a variety of medium, and this is just some of the kind of pictures and images that have been created through our workshops. Series of 4 workshops, getting to know the women, looking at the themes, for example, looking at what we wanted to talk about as a group. And I think what's really important, and again, I'm not too sure how many people are working in the arts space here, but we don't lead this work. This work is really about co-production. So we have an idea and we take it to the group to see if actually our idea makes sense, if it has resonance, and then how can we solve this issue together. So we use a variety of different arts and discussion. We use poetry, and you can see all the different sorts of medium that we use. And we talked a lot about our experiences. And what we want to show you now is is an animation. So we're presenting the findings of the research in quite a novel way. We're not presenting them in a formal academic paper, although that no doubt will follow. But we want to show you the first of what will be a series of animations co-produced by the women from Juno Women's Aid and ourselves. And this is based on persona and the poetry. So I think, Parveen?
Yeah, you'll have to unshare it and I'll share.
All right.